You know, we've come so many times to Bienville Orthopaedic and talk to some of the specialists that they do have in so many different areas. Well, today we're talking to Dr. Matthew Lewis, who is a specialist in hip, excuse me if I don't get his arthroscopies?
Arthroscopy.
Or arthroscopy. I know I messed that up. Arthroscopies, it's a big word and it means important. Tell us a little bit about yourself first, if you would, Dr. Lewis.
Well, I grew up just south of Jackson in the Byram community of Mississippi. And went to medical school in Jackson at the University of Mississippi Medical School. I then did an orthopedic residency in Kansas City at the University of Missouri, Kansas City up there. And then came back to Jackson and did a sports medicine and arthroscopy fellowship at Mississippi Sports Medicine.
Now, talking about hip arthroscopy, what is that exactly is that? I guess that's hip replacement?
It's not quite. So hip arthroscopy is a surgery that we can do hopefully before a person needs a hip replacement, so hopefully to try to keep them from getting to that stage. It's basically a surgery done through small incisions around the hip, usually 3, and we're able to access the hip joint using a camera and instruments so that we can correct problems such as arthritic changes, labral tears, injury to cartilage, and all those sorts of things in the hip.
I was going to ask you, what are some of the symptoms or the problems that a person might start having that they would want to think about, well, I probably need to go see a specialist because I feel like my hip's not working properly?
Sure. Yeah, hip pain is one of the more common things I see in my practice, and it can be due to multiple different problems. Some of those are inside the hip joint, some of them are outside the hip joint, and sometimes it's even from the low back. So making the correct diagnosis is the most important part. And once we know that, then we can really treat the hip pain appropriately. But yeah, some of the more common problems are just the beginning stages of arthritis in the hip, labral tears, which is soft tissue in the hip that can develop tears in it that can be painful. And also there's a condition called hip impingement that's a little bit under-recognized in the community, where people have bony prominences on either side of the joint that can actually pinch and tear that soft tissue. And those things are often amenable to non-operative treatments like therapy or potentially hip arthroscopy if those things don't work.
Now, with someone that is in sports, I guess that you see more of that with sports-involved injuries than maybe as the older that we get, that we start having issues.
That's correct, yeah. A lot of athletes will end up having hip impingement problems, labral tears and things like that, but it's also very prevalent in older populations as well, middle-aged, 30s, 40s. It's very common to see labral tears and hip impingement in some of those people who have actually had it for a while and didn't know it.
Oh, really?
That's correct.
And if you go on for a while and not have it corrected and just say, oh, I just got a little catch in my hip or something, that could really lead to a bigger problem and to possible hip replacements. Very
true. We know that hip impingement over time, unrecognized, leads to arthritic changes in the hip, which ultimately can result in the need for a hip replacement down the road.
And that could really cause there's a longer recovery protocol for that than there is just for the surgery that you do.
Yes, the hip arthroscopy is minimally invasive, so we're able to get people kind of recovered a little bit quicker and with a little bit less pain than an open procedure.
I was going to ask you, what's the usual downtime for that kind of situation?
It takes somewhere around 2.5 months for repairs of soft tissue to heal. So people just kind of have to take it easy for those
right.
couple of months.
They're not totally shut down.
Not totally shut down.
Right.
No, you're still able to be up and around.
Don't run any marathons or
that's right.
Go play football or something like
that's
that.
Right. That's right.
That could compound the issues that you're having.
Yeah, but we have a good therapy team and a protocol that they go by to really progress people week by week as they get further out from surgery.
Yeah, we've been here before and seen a lot of the area where they do therapy themselves, physical therapy, to work with people doing that, which is an important thing to do. But to hopefully cut down on having those issues, it's always good to try to remain active as in your everyday lives.
Exactly. It's so important to stay fit and stay active and stay mobile. That's good for the joints. It's good for your overall health. Keeps everything moving and keeps you from slowing down. And once you kind of slow down a little bit, it's hard to get back going again.
This is true. So I mean, it's something that a lot of young people they stay pretty active, but there's no reason why, you know, as we mature, I don't like to say get old, as we
That's
mature, that you can stay active too. To be honest, at the age of 64 now, I just got back into martial arts, and which I hadn't done in over 25 years. And it's taken me a little bit to get adjusted to it, but I feel that, you know, doing things like that, keeping myself active, I won't have these issues down the line.
Yeah, that's true. Prevention is very important, and you know, it's normal as we age and mature that to have aches and pains and things like that, and problems start to arise that you didn't have before. But it's important to come have them checked out because there may be a simple answer for it.
Mm-hmm. Now, any other types of I mean, one of the other things you specialize in was sports medicine.
With sports medicine, sure, I do arthroscopic surgery of all the major joints. So I also treat a lot of shoulder problems, rotator cuff problems, knee issues, ACL, meniscus tears, all those sorts of things, in addition to the hip.
And we probably see a lot of those things, not even not necessarily sports related, but as we get older, that I use that word, as we mature, that you know, just doing simple things can cause some issues, in, you know, like you said, in your shoulders, your arms, or your knees, or whatever.
Exactly, it's normal. Everyone accumulates wear and tear changes of those types of tissues in all of the joints, and it's inevitable that at some point a joint's going to start hurting you, and it's like I said, it's helpful to be able to come and have an accurate diagnosis made and get the right treatment so you get back going again.
Now, does someone need to go see their general practitioner first to get a referral to come see you, or if they're having some issues or whatever, that they can go ahead and say, I think I need to go see a specialist?
No, not necessarily. No referral is needed. Patients can call and just schedule an appointment, just self-referred. So. Okay,
all right. And any other type of issues you want to talk about? That pretty much covers it all. I mean, as you said, your specialties is the hip surgery.
Yeah, like I said, all sports medicine, but the hip arthroscopy is one of my areas of special interest.
And you're the only one around here that does that, I believe.
That's correct. I'm the only one on the Mississippi coast that I know of. Yeah.
That's good. That's awesome. Well, Dr. Lewis, we appreciate you sharing this information with us again. Again, if you're having some issues with your hip or any type of, you know, sports issues that you might need a specialist from Bienville Orthopaedic Center, you can call the number on your screen. You don't have to go to your general practitioner and get an appointment first. They'll be happy to see you. And, you know, get yourself back onto the road and of better mobility, should we say.
That's right.
It's better mobility. Anyway, Bienville Orthopaedic Center here on the Mississippi Gulf Coast, they can get you moving again.